Hi everyone, we're coming to you today with a special research briefing to talk about a new study from the Mayo Clinic that suggests that the use of antibiotics in children during the first 2 years of life is linked to a higher incidence of celiac disease, allergies, asthma, obesity, ADHD, and other conditions. We have our amazing research director from Boston Children's Hospital Celiac Disease Program, Dr. Jocelyn Silvester, here to break down these findings and help us really understand what they mean. So, Dr. Silvester, tell us about this research. There are lots of anxious parents out there who saw this article on CNN and other major news outlets and are feeling pretty filled with anxiety about having given their children antibiotics. Did giving them penicillin to treat an ear infection lead to celiac disease?
I think it will be very hard to make that connection, particularly based on this study. So when we look at this study, it's important to think about what type of study this is. And this is an epidemiologic study. And so what they've done is they've looked in Rochester County, Minnesota, which is where the Mayo Clinic is based. And they have a really good registry so they can look at what happens to people over time. And it's almost like they're all in the same healthcare system. So it's not like they went to one hospital's emergency room and got their primary care somewhere else. And so they can start to look at what happened over the years. And so what they did is they looked at antibiotic prescriptions, and then they looked at development of these other diseases that you're mentioning. Now, what's really important to remember is that these children all had the prescription for a reason, and that they weren't randomized. So when we really look for causation, we try and do a randomized trial so that we assign one group to the intervention and one group doesn't get the intervention. But in this case, what they did is they just looked and saw what happened. Some kids got antibiotics because they needed them, and other kids didn't need antibiotics and didn't get them, and then what happened long term.
Got it. So the study suggests that antibiotics seem to affect girls developing another condition with only 1 or 2 courses of antibiotics, where it took boys 3 or 4 courses to see an effect. Why would this be?
So I think it's important to remember that there's lots of differences between boys and girls, and we think of hormones as being involved in sex characteristics, but they're actually involved in regulating many other functions in the body. And so this may actually be a biologic difference related to sex and not related to the antibiotics per se.
Great. So, what advice do you have for parents who are feeling pretty uneasy after reading this about future antibiotic use for their kids? How do they know when it's right to give their child an antibiotic for an ear infection or a sinus infection versus waiting to see if it clears up on its own?
So I think this is a difficult thing for parents because it has been over the years a bit of a moving target. And I think as a medical profession, we're sort of moving away from giving antibiotics for a lot of indications where 10 or 20 years ago, it would have been more quick for us to reach for the prescription pad. What I tell my patients is that they know their child and they know when their child is sick. And so it's important to consult a physician or a healthcare provider and not to self-prescribe antibiotics. Sometimes families will have antibiotics from an old prescription that they will use. They definitely should not be doing that. And I think it's really a discussion with your healthcare provider about what the options are. What's important to think about is that you don't give your healthy child antibiotics for the most part. And so in this study, the children who got antibiotics were sick. And we know that having illness affects the body, just like having antibiotics affects the body. And that's one of the things about this study is that they don't really know about the people who were sick with the same thing, but maybe didn't get antibiotics. And so it's hard to differentiate. Was it because they had an RSV infection, which we know is associated with asthma, that they got asthma and it was a virus, but somebody thought they might have a pneumonia and gave them antibiotics. So now we see the antibiotic prescription when really they just had a virus in the first place. It kind of gets hard to tease out. I think really ultimately antibiotics are one of the biggest medical breakthroughs of the 20th century and have saved a lot of lives. And if your child needs them, you should give them to them, especially if your doctor recommends it.
Great. So, what do you think the future looks like for this type of research? And what do we need to know to really understand how antibiotics are affecting our kids?
So I think there's a few things you could do to augment this type of research that are hard to do because they're really expensive and they really take a long term. So if you're concerned, for instance, about the microbiome, you could take measures of the microbiome by taking stool samples, for example, and get samples from every child at a certain frequency and then try and study the differences and see if that correlates. Obviously, that's something that requires a lot of work on the part of a lot of people, and that's part of the reason why these studies are really not practical. We also talked a little bit earlier about, well, could you just randomize so that you flip a coin to see who gets antibiotics and who doesn't? And because we know that the antibiotics save lives, that's not really practical either. I think we're lucky in that our study designs are becoming more sophisticated. And really what sets this study apart, there's not actually new information in this study. What's unique about this study compared to previous studies is that they were able to look at a bunch of conditions all in one study. So there's been data on obesity and antibiotics, on asthma and antibiotics, and all of these conditions and antibiotics, but nobody's looked for all of these conditions in the same kids in the same study. And so that's why this study is getting attention. It's not necessarily that this concept is new.
So Dr. Silvester, is there anything that parents can do to prevent their kids from needing antibiotics?
That's actually a great question, and I think it's one of the things we often forget about. And we talked a lot about vaccines lately in the context of coronavirus, but really the big pediatric vaccines more recently have been for bacteria, such as the pneumococcal vaccine. And these have caused dramatic decreases in ear infections, in epiglottitis, in conditions that we commonly treat with antibiotics, because pneumococcus is a bacteria. So certainly getting your child immunized is going to decrease their risk of needing antibiotics for these preventable infections. Also, hand washing. We've really seen a decrease during the coronavirus pandemic as people are more attentive to hygiene, and that applies to the coronavirus as well as these other bacterial infections that need antibiotics.
So before I let you go, we're going to switch gears for a moment. So here in the United States, we know that this week is Thanksgiving, and there's a study out of Canada from McMaster University that suggests that eating tryptophan can reduce inflammation in celiac disease. Does this mean that we should all go eat a whole lot of turkey this week?
Well, I think it depends. If you like turkey, then possibly. If you're Canadian like me, then you probably celebrated Thanksgiving in October, like the researchers at McMaster. So turkey may not be on the menu, but definitely, if you like it, gobble, gobble, gobble.
Well, thank you, Dr. Silvester, so much for explaining this. I know that it will help a lot of our patient families feel better about having read these big news headlines this week.